My guests today are Robbie Monahan and Kim Roberts. Today, we're going to talk about a pharmacist in recovery and a pharmacy leader that provides a safe place for the pharmacist in recovery, their peers, and their patients. But first, I want to welcome you both and give you an opportunity to share a little bit about yourselves. Did you both always know you wanted to be pharmacists when you grew up? So, Robbie, let's start with you.
Yeah, well, thank you so much for having us on here, Miss Harry. For me, as a pharmacist, no, that I wanted to be a school teacher in the beginning, and I thought I would teach and coach sports, like most has-been athletes where I grew up, tend to do. And I realized I didn't have the patience to teach. I wanted to snatch a kid up if he acted out of line, and you can't really do that anymore. So I actually got a job. A friend of mine was working in a local Rite Aid where I grew up, and I got a job there, and just loved it because the thing that still to this day I love is very few places do you have the opportunity to interact with this many people and have like this many opportunities to have an impact on somebody's day. And I was, it's one of those things where it's the intersection of you're intelligent, but you're also personable, and you like business, but you also like to be creative, and it's a great opportunity for somebody who has a lot of interest to jump in. So, been doing that now. Pharmacy is kind of the only real job that I've ever had. And in high school, I DJ'd at a radio station. I washed cars at the local dealership one summer, and then my next job was in pharmacy, and I've been there ever since. So, I've been a pharmacist now 16 years.
Okay, all right. Kim, I think you have spent your whole career at the same pharmacy, if I'm reading your LinkedIn correctly. That makes you the second person I know that has done that. That's pretty amazing. So tell us about you and how you got started.
So I have always had an interest in probably just the medical field in general. I think early on, I realized I didn't want to commit my whole life to, maybe going to medical school and all that was going to come with that, but I still wanted to have a connection with patients and such. So in college, I'm actually from Nashville, and what is now the H.G. Hill Center. I used to work in a pharmacy called Bradshaw Drugs, and I very early on fell in love with independent pharmacy and what that looked like in the community. And then when I finished pharmacy school, I applied for the residency here at Markram's. And so I did a year as a community practice resident. And then I knew that I would be in Manchester because my husband has businesses here. So I had the privilege of staying on. And at that time, which is significant in my recovery journey, I was having children, a lot of children. And so I was trying to balance that as a mother and also being a professional. And so that is part of a little bit of my story is, putting all that together in when I came on here at Markram's. But yes, I have been here ever since. I actually do something a little bit different here at Markram's. I focus on hormone therapy. And so I'm not on what we call the counter as much, but that's basically what I offer is functional medicine in our setting.
Okay, that's great. Yeah, why don't we talk about a little bit your journey? So interesting, balancing career, children, and recovery. How just run through your life on that score with your substance use, and what was the substance that you were using, and how did all that play out with work and home? And
so interesting enough, I really was not a partier. I really was not a drinker, even in pharmacy school or college. I really had not used a lot of other illicit substances, dabbled in anything. And I had at the time, I had 4 children, and actually I had just given birth to another child, and I was sick. And I had some cough syrup. My drug of choice was Hycodan syrup, which ironically I hardly ever see anymore. And I, was, like I said, I was sick. It was around Christmas time. I had unrealistic expectations that I should create this incredible home, work, Christmas time, and I'll never forget. In fact, I can still remember it very vividly. I took the medicine that because I was sick, but something clicked this time. And when it went down, I was off and running, and it wasn't just that, but there was a lot of other life circumstances that were going on. And it was a way for me to handle it because unfortunately, and this is one thing I like to talk about in our pharmacy schools, I don't know that we are always teaching them good coping skills. We are just pushing, pushing, pushing.
Mhm.
And every time we have students that come to our TPRN group meetings just to see what it's about, every time they've always asked, could we come back? We just feel like we're heard, people understand
Mhm.
what's going on with our life, our stress, our anxiety, and it's just a safe place for them to talk about. But at that time, I didn't take the time to work on me or do self-care. And that was one of the problems, is because I wanted you to think that I had it all together, and I did not. And so my use was probably over 2 years, which a lot of people would say, well, you really didn't use that much. But it's not about how much you use, it's about the impact it has on your life. And it was devastating. It was, but to that point, it was also a gift. In part of that, of getting the help that I needed, it really was a gift that changed my life for the good. And so one thing they talk about is you will not regret the past, nor will you wish to shut the door on it. I don't want to go back to where I was, but I am very thankful for where I have gone and where I am now.
Right. So interesting. If you don't mind, I'd like to dive in a little bit deeper. Was that the first time you were exposed to opioids, or this was the first time that something clicked?
I probably had some opioids and other types of procedures, but
Yeah.
again, like like a normal person, I used it
Mhm.
as I needed appropriately, and then I either threw it out or it was still sitting on the medicine shelf.
Yeah.
But this was different. This was different.
Hmm.
And again, this had sat in my cabinet for quite some time. So that was pretty much the extent of my exposure.
Hmm. Interesting. That's fascinating because often seems like what I usually hear from people is that first exposure was where something clicked, not kind of later down the line.
As you dive
Um,
deep into your recovery journey, you will
yeah.
realize, as I did for myself, there were other things, perhaps they weren't drugs, but there were other habits and other
Okay.
things that filled that void for me. I didn't
Okay.
realize it as a problem then. I mean, it could be something as crazy as shopping on Amazon. You get a little dopamine fix
Mhm.
with that.
Sure.
So, if I really am honest and I look back, there were things that I had did. Maybe they weren't drinking or substances like that, but they did
Right.
fill a void.
Yeah. Yeah. And important what you say about the coping skills too. I mean, my goodness sakes, 5 children is hard enough, let alone working with 5 children and, all of the other stuff that comes with it. So that is a lot.
Right.
You would definitely need some good organizational and coping skills for that.
Yes.
Yeah. So, Robbie, you've been with the pharmacy, I think, roughly 3 years. Is
Yeah,
that
almost
correct?
3 years. Yes, ma'am.
Okay. Were you hired straight into pharmacist in charge role, or were you part of the staff to
I
begin with?
wasn't. So I was the PIC at a neighboring farm at another pharmacy, excuse me, in our community here, and um, so Markram's pharmacy, in Tennessee, it's kind of one of those things you kind of grow up hearing about. My mentor in East Tennessee and Ray Markram were classmates. They're friends. They're colleagues. So I heard about
I didn't know that.
Markram's. Yeah. So
Yeah.
I knew about it, and I always kind of wanted to be here. So when I got close to here, of course, I would just befriended people, and so Joe McCamey, who's owner and our GM, and he and Ray's daughter married. And so Joe and I would always talk, and one day I would always be like, if you have a need, if you have an opportunity, holler at me. And it's just like, see you later. And that time it was like, well, let's talk about that. And so we knew that eventually that was the route we were going to go. Michael, who was serving as our PIC, was wanting to work a little less. And so it was kind of the natural progression. But I actually really like that. My dad, I'm a first generation college student. My dad was a coal miner. And so one of the things he instilled in me, I grew up in Southwest Virginia and kind of West Virginia, Eastern Kentucky area. There was a lot of mining strikes that were going on in the 80s. And really a lot of workplace etiquette, just a lot of be willing to work hard and also be willing to understand your coworkers and never ask anybody to do a job you wouldn't do yourself, or all those things are stuff I grew up hearing. So for me, it was great to be able to come in and have a chance to get to know people before. And maybe it's not that way everywhere, but our staff is, you probably hear people say this stuff all the time, but our staff's wonderful. And it's not really well, Robbie's this or Kim's that or Michael or Richard. Like, we all just genuinely work together to accomplish things, because I'm very well aware when I'm not the smartest guy in the room. And so I think that's a skill that we all have, is we lean on each other's strengths really well.
Right. Okay. So when you became pharmacist in charge, you were already aware probably that you had at least one employee working that was in recovery.
And so this is interesting. When I first met Kim was also a figure that about in Tennessee. She is a Tennessee Pharmacist Association Pharmacist of the Year. Like, she's someone who you can kind of know about, right? And she's also, not just because she's sitting here, she's a lovely lady. She has a lot of, she's well known, well respected. And I had a little bit of imposter syndrome when I first kind of met her. And I met her at a conference, and she's busy. She's running on to do all kinds of stuff. And this guy introduced us really, really briefly. And I don't think either one of us really had time to have a conversation. And then I walked away thinking, oh no, she doesn't like me. Does she not, she doesn't like me. And the place that I had worked, there was a little bit of animosity that I didn't really know about with some people that had worked there and some people that had worked here. And so we didn't really kind of know how to take each other in the beginning. But the other thing is just, I had no idea until, Kim was open and she told me. But that's another thing. I think there's a beauty in Kim's honesty and humility, and in the way that not just Markram's, but I think the TPRN and the way our state operates is, if you're genuinely, working to work on yourself and to not make those same mistakes, it's not like you're walking around with a scarlet letter on yourself all the time. Okay. So I had no idea. Now, she was open and in conversation, talked to me about it. But
if you remember, I hadn't made you an amends.
Yeah.
The first time.
That's very true.
To him, which is part of our program.
Yeah.
You we teach work your program and all of your affairs. And when he first came in and we sat down, I said, I owe you an amends. I said, I have judged you, and you don't even, you didn't even walk through the door unfairly. And so I had to go and tell him that, because it was, I wanted to wipe the slate clean, even though he didn't know it. It would affect me in my mind.
Yeah, but again, not that we hide it, but also there's probably a lot of our staff that's not aware of Kim's history. Just because, number one, that's her story to tell and to share as she sees fit. And also, I was able to share it this way with a patient who came in who's in recovery. And again, not that we hide from our past. Kim said that very well. But also, you're not just your past either. And in this instance, I could tell that patient every interaction they were referring to themselves their addiction was always the first thing out of their mouth.
Yeah.
And
It
and
doesn't
in
define you.
exactly,
Yeah.
and
Don't let
that
it
was the
define you.
conversation. Don't run from it, but don't let it define you either. So yeah, I think the world of Kim, and it's also a testament to Ray Markram. Ray passed a couple of years ago, but Ray, not just in Kim and in our staff, you can see the fingerprints all over our community. Genuinely caring for folks, faith-focused pharmacist, and everything. It's still here. If you build something that outlives you, I think you've done a great job, and he did that.
Right. Yeah. Okay. So not all your coworkers know, which might change if anyone watches the podcast, but
No, most of them
well,
do.
I guess,
Yeah.
And I guess it doesn't really, I mean, it's not, hi, I'm Kim and I'm in recovery. I mean, that's not necessary,
And
right?
that's the point.
Yeah.
I may make comments that that didn't work out well for me drinking. I'm not taking that up anymore. I will make little comments like that. Or if somebody brings up something, like there was an individual that we have that is recovery friendly. And I did know that. So I did go and say, I want you to feel safe with me. And, if anything starts talking to you, just come tell me. It's not going to bother me. So
right.
I did make that
Just
known.
put it on the table. Yeah.
Exactly.
Let's not do any wondering.
Right.
So you clearly have a return to work program, whether you call it that or not, but you do. What measures do you have in place that, one, would help Kim succeed, and two, make other staff that do know about it feel comfortable and allow them to trust the system and Kim more?
You want me to answer some of that? I've thought about this a lot. There are certain jobs, there's nothing that's beneath me. If I need to clean a toilet, I'll clean a toilet, whatever. But I do specifically stay where I should be. Again, it's not beneath me to count pills, but I'm a pharmacist. Use me for my brain of, checking and counseling and such. So you're not going to find me behind the counter because I could easily count an extra pill for me. You're not going to find me in the controlled substance vault. I will ask somebody else, could you go get this for me? Or another example, and again, it's funny because my mind, I'm thinking about when I was active in addiction. I remember we were doing an inventory and I was panicking already, like, how am I going to make this all line up? So I don't need to do the inventory count, and I never have on the controlled substances. Little things like that. I don't check my own prescriptions. That should be a rule no matter where you are. I don't check out my own prescriptions. Just it doesn't matter if I'm the only pharmacist here that day, then we're going to leave the prescription till the next day. And I know that is one thing that we really impress upon our participants, because that's come up quite a bit, even in TPRN. But those would be the biggest areas that I would think. I don't order controlled substances. I don't really know what we have. I don't do any of that. So I'm glad he has that job and not me.
Well, and one of the other things, for example, that I think is, and I didn't come up with this, maybe you did, maybe Ray. So Kim has a key, obviously, to get into the pharmacy when she works. Let's say she works Saturday or whatnot. But one of us, so we take call. So you got Kim and then three other pharmacists that are here full time, myself, Richard, and Michael. So one of the three of us will be on call at any time. So we do after hours call. So whoever's on call when Kim's working, well, at the very least, they're the ones that turn the alarm off. And then when she leaves, she lets us know that she's done, and we set the alarm. Some of the guys sometimes will just come down and open with her, and just because, again, to Kim's, she said she does a lot of consults, she does a lot of things. When she's working on the bench, a lot of times she's covering one of our vacation days, or she's, it's not necessarily her comfort zone. So sometimes we'll jump in and help. So I think that's a really smart thing that we do.
Yeah, and to that point, in the last 5 years, they did, our general manager did approach me and say, would you feel comfortable with a key? And I said, under one circumstance, if you don't give me the code to the alarm. That's just me. It'll just play in my head.
Yeah, that was smart.
So that way they are able to manage everything remotely as far as the
Right.
alarm, plus there are cameras. And I know this is going to sound crazy, but pharmacies need to make sure their cameras work. I've had too many pharmacists that have actually got up and taken the cameras down and nobody ever checked them. So I'm grateful for cameras. That is another little thing to keep you in check.
Right. Yeah, true. So you have access to the pharmacy when you need it, but somebody will always know when you have access.
Exactly.
Correct.
Because, yeah.
Yes.
So they don't have to worry about why was she there.
Mhm.
Okay. Now, did you self-report yourself? Did you get caught
Yes.
at work?
Yes and no. I did self-report, and at the time, Roger Davis, who was over the TPA, who then started Lipscomb Pharmacy School, I knew him and called. But the reality is, I knew I was fixing to get caught. Most of us know that it was coming. Fortunately, I think probably Ray knew that and extended some grace and allowed me to come forward and get the help that I needed. So I did attend a treatment center, and I followed what our TPRN, what their guidelines were for treatment. And then, I came back, and at the time, the board also has, I did surrender my license, although the board was not aware of me. Technically, I would not have had to do that, which I'm grateful for, because I think one of the reasons people do not come forward is the fear of the board. And sometimes if you come on and tell us, we can help you without the board ever knowing, as long as you are monitored and do what we ask under TPRN. So I did go to treatment for about 3.5 months. And then I stayed out of pharmacy for about at least 3 months, I believe. And then I petitioned for my license to go back. But during that time, I know that it was during the time where we were doing lots of flu shots. And, I could not work as a pharmacist, but Ray did ask me, would you like to come back and help us give flu shots? And I said, I think I would. And that was a way for me to get my foot back in the door, because initially I was really afraid when I walked in that the drugs were going to jump on me. I mean, there's that much fear. And I just needed a baby step and some hand holding. And, I had a lot of, again, most of the people knew, that we're here. And so I had a great support team, but it worked out well.
Yeah. Okay. I want to talk about that, your return to work, but every time you guys say TPRN, I keep thinking I need to tell the listeners that's the Tennessee Pharmacy Recovery Network. And we're going to talk a little bit more about that in a bit, but that's what they're referring to. Right. So Kim, tell us how it did feel returning to work then, and with people that knew what had happened. And, here you're afraid the drugs are going to jump at you. They're probably afraid, like, I don't know if we can trust her, but wanting to give you the benefit of the doubt, I'm sure. So how did that feel?
My problem again was mainly me. I had a lot of shame still around my addiction.
Sure.
And that's a process of working through that, and not, realizing it was not a moral issue, that it was, I was sick. So that took a little bit of time. And thank goodness I had people here that were, more forgiving, and they were willing to work with me. They weren't shaming to me. They were like, how can I help you? But they were also honest in calling me out on some things. For example, sometimes I don't need to sign up for that extra work shift because I'm a big people pleaser. And I'm grateful for like TPRN that would say you can only work 40 hours. It's not in your best interest to work more than that. So there were lots of, boundaries that were set in place that helped me, whether it was directly from the pharmacy or from our recovery network program that we had.
Okay. I want to talk about, Robbie, the rest of the staff. Now, if not everybody knows that someone in recovery is there, when you talk to your staff about diversion or substance use disorder, I guess the first question is, do you talk to your staff? Second is, do they receive it more openly, or do you think it's just like any other pharmacy out there where they get a little offended if you try to put some accountability measures in place, because it's like, well, why would you think I would do something like that? Or are they more accepting of that because Kim is there?
So that's a great question. I think, for example, I would say the staff who've been with us any length of time are aware. We've just hired, I think, so we have a staff of around 40 people.
Okay.
And so we've just hired in 5 or 6, students and new adults and those folks. And so we've got some folks that have been with us just a few months, and it's not organically come up. It does, because she's very honest. She's a very friendly person. And like she said, she doesn't hide it. So it's going to come up. But I think the other thing is that it's important. We're a faith. Faith is very central to the way we practice. So, we don't have crosses on the walls and all those sorts of things in the pharmacy. Nothing against you if you do. But it's very central in the way we operate.
Sure.
So an example of that is we always encourage our staff to be humble in the way that they approach any situation. And, but for the grace of God, there go I, and that'd be my mistake. We also are in our orientation, new hire orientation, we do go over diversion, fraud, waste, and abuse. We're also very, very careful in our processes. Give you an example. One of the things that we have started to tighten up on is inventory management. Not that we do a bad job, but we're a store that's filling probably 15,000 scripts a month. And so you're going to have some variance on your numbers. It just happens. You hope you don't have it on your controlled substance, and you hope you can explain it when you do. But it's going to happen from time to time. Broken tablets, things drop on the floor. You understand. So we were trying to have some better processes. So now one of the things that we've done, we have a Parata pass robot. We never had any login credentials in order to go in and do anything with the robotics. And so now anyone who goes in and adds or removes or does anything with that has to sign in first. So we tried to do some kind of blind spot analysis, risk analysis, however you want to phrase that. And I'm sorry if it gets loud. It's raining here. But
I wondered. It's like, where's the? Yeah. Okay.
But it is it's a process that also, if you're what we would call our counting techs, if you're our technicians that do primarily the filling of prescriptions, we're going to talk a lot more with them about some of our inventory management and those things than we do our customer service staff that are primarily running our cash registers.
Sure.
So we're going to be talking more. Still, we cover diversion, theft, and those sorts of things, but we cover it, through different processes. And then the last thing I would say is, the state of Tennessee has been very forward in some of the things that it has done around opiates, for example. We cannot do more than a 3-day supply without ICD-10 codes, or first fill 3-day supply. Then we can't do more than 10 days without ICD-10s. We have to gradually get into chronic opiate management. I know all of that came out of the all of the opiate problems that we had in the last 10 or 15 years.
Right.
But I think just getting, sorry, I went on turned left and went on a tangent there on process. But I think ultimately what led me down to talking about all the processes we developed when I implemented that there was a little pushback, and I think this was one of your earlier questions: is how do people respond to that? Because if I look at the cross reference of the staff that are counting, mainly going to be younger folks. Some of them, this is their first like real job. And then you talk about something like that, it hits them with, you think I would steal from you, and
Right.
just to have that conversation of the way that I tend to phrase it is, I'm not saying at all that I think that you would do anything like that. What I am doing is I'm putting every resource in play that I never even have to wonder. So
Right.
we're going to take any of that thought out of your head ever. And so when I explain it that way, that what we're really doing is protecting not just the pharmacy, but them,
Right.
then they understand it a little better and they get on board.
And
Right.
to that point, you asking about, is that offensive to someone? It should not matter. It doesn't matter because
Yeah.
number one, that needs to be in place for the protection of me and for the protection of the public. So regardless if somebody's offended or not,
Right.
it does not matter, but it needs to be there.
Yeah, no, I agree. Are there some of those processes, Kim, that you think if they had been in place, then it would have helped you
Well,
when
I'll
you
tell
were
you,
going through things?
yes and no. And I actually do a lecture at the pharmacy school, and I'll tell them, I'm going to teach you one of two things. I'm going to teach you either how to identify drug abuse, or I'm going to teach you how to steal.
How to steal better.
And either way, if you get that, you have succeeded.
Yeah.
But one of the things during that time is, narcotics, you could still write scripts for them. So that was weirdly in my mind. I didn't want to just take it off the shelf. I actually wanted to pay for my prescriptions because I didn't want to steal. Now think about that logic there, but that's how an addict thinks. And so with us not having that, e-scribing, I think that is good, and kind of, goes around a little bit of that.
Mm-hmm. I think
I
one
love
of the
it.
things
You
too
didn't want to be a thief. Yeah.
Yeah.
That's right.
One of the things too, and I'll probably be a lot more focused now that the rain has subsided. I'm not as squirrely there, but the thing that I think is helping, that again we don't know, but actually it wouldn't have helped, because if you're writing scripts for it, it wouldn't have showed up.
That's right.
Because one of the things that we try and look for is, if our inventory's off, we will then go back and do cycle counts and try and identify
Sure.
those things.
Yeah, sure.
But yeah, no, it wouldn't work there either.
Yeah.
Yeah. I'm curious, Kim, were there things that you think your coworkers should have noticed, but they just made excuses for it?
In hindsight, when you think about the behaviors of people, they become very, vivid. So, for example, I would disappear to the bathroom a lot. So I know people are like, what's wrong with her bowels, or what's going on? She's always going to the
IBS.
bathroom.
IBS.
Yeah. I know a lot of people would think, when you think of somebody using, they're going to come in disheveled or something like that, but that's not necessarily the case. Sometimes they may all of a sudden really be hair out to here and really put together. So it can go in all different directions, but people really need to pay attention to a gut instinct. There's a reason why you have it, and you're usually not wrong, although you don't really want to say that, but they do need to notice little things. And of course, there's nothing wrong with saying to someone, I'm concerned about you. And I know that can be very awkward for people. Like, what, I don't have it all together to you? But I didn't. And so I think sometimes if we have those gut instincts, to potentially bring them up.
Right. Yeah. We are fearful of that. And I think part of that, I mean, if you can get your culture in your organization and you're being the faith-based and trying to have that kind of culture, could go a long way to reducing the stigma, making them aware that, substance use disease is a thing. And so if you think you got it, then, let's get you the help, and we're a company that will support you through that. And so, yeah, we may ask you if you're acting kind of squirrely. Is there something going on? And then hope that we can get you that help.
Mm-hmm.
Mhm.
Yeah. So let's talk about the Tennessee Pharmacy Recovery Network. So Kim, you utilized that service. What kind of support do they provide? And I believe you indicated they're an alternative to discipline.
Um, it's, if you are reporting to them before the board finds out,
Okay.
then you can sign a contract with them and they can work with you. Now, let me give an example. I've got some participants that did come into us, but they have had some DUIs that they did not report. Now that's starting to come down the wire. And of course, that's going to get reported to the board. But here's the thing. Somebody can call me. My name is listed on the website. They can call me anytime. I'm not here to report you. I'm here to just talk to somebody through that process, because it doesn't matter what I think. They have to come to that realization themselves.
Sure.
Once I had an evaluation and they said, we think you need some more inpatient help. And I completed that at the recommendation of the medical team there. And then when I came back, there were things that I committed to doing, such as like 3 meetings a week, in my local community. One of those is usually with a group of just health professionals only. In our case, we have about 8 groups across the state of Tennessee that meet. And one thing that's interesting about Tennessee is all of the advocates give of their own time. They're not a paid position. So these are people that have participated and are paying it back, giving it forward. So we have kind of a process group where we check in every week. But we also require random drug screens, under that contract. Most contracts are about 5 years. And then, we've had tons that have completed that and gone on to do great things. So it is a great program.
Yeah. When you first came back, did you go back to the bench, as you call it, or did you go transition into the hormone work?
No, I did some things that were, I wasn't a pharmacy tech. I don't recommend that for somebody initially coming back. If there was something else I could have done. In my case, it was the flu season, so I was going out doing flu clinics. But usually we have people stay out of pharmacy practice for 3 to 6 months. I mean, there are some circumstances. Again, it's based on what the health professionals and the treatment team say. There are some cases where they have said we're okay for them, to go on back. But when you're under contract with us for at least 2 or 3 years, you're not going to be the pharmacist in charge. After that time period, you could petition the board if that was a need for a pharmacy, and we're not going to float around. That's where you get in trouble. It's like if you got a lot of chains or several locations, that's where you can manipulate some things. So we're going to have people usually stay at one store.
Yeah. I'm just curious. There are people that are not in favor of any healthcare professional, regardless of your license, going back into a position that gives them access to controlled substances. And so now it sounds like you have access because you're in the pharmacy and it's there, but you're not working in the capacity where you would need to access it.
Right.
But when you went back after the flu season, did you go back to having access? And
I did.
On top of you did. Okay.
Yeah.
So what would you say to those that are very much against, you should not have any access, period? You can
take the drug away from the person, but they still have all the issues. So the drug is just a symptom of my problem. If I am spiritually fit, I can handle anything. I can have Vicodin syrup all the way around me. It will not impact me one bit if I'm spiritually fit and if I'm working a program. And that's the key. And so I do understand where a lot of people are very hesitant, but I would think if Ray Markham were here right now, he would say, hiring me back was good, but I think it's paid off for him. And I think a lot of other places that have taken that risk would say the same thing as well. So I would ask them to give them another chance. And the other part of that is we are so on, monitoring these people. We are truly up in their business. So if they're not behaving properly, or if there's things that are concerning to us, we're gonna have a talk with them. So
Right.
even though we're not just looking at their life as well. How are they? Because sometimes they'll come to our process group and talk about workplace situations and things that are going on, and we call them out for what their part is in that. So
Sure.
I would hope that they would be open. If other,
Right. Okay.
One of the things too, Terry, that I've been thinking about the whole time. Kim said it early. One of her biggest problems was she wanted everybody to know that like she was on. She didn't have a down moment, and I think that's so true of all of us in healthcare: pharmacists, technicians, prescribers. The old adage of the mechanic's car won't run. The healthcare folks, we don't take care of ourselves.
Mhm.
Myself, I'm not physically taking as good a care of myself as I should. I can joke about it, but that's difficult. And I think, you and I shared in a conversation, because of the family situation I grew up in, most of my immediate relatives, several of my immediate relatives have battled drug addiction. I recall, I preached my sister's funeral from a drug-related car accident. And so when that happened, I ran away from pharmacy for a while. I felt like the biggest hypocrite in the world. And I felt like there's no way that I can do this, because if I can't even speak to my sister, if I can't make a change in her life, then whose life can I affect?
Sure.
Right.
Yeah.
I got out of pharmacy for about a year and realized I really missed it. I missed taking care of people. I'm a caregiver in nature. But one of the things that I think is so important, and it's part of our culture here, like, sure, Kim has folks that'll keep her accountable to her issues. I just had a great conversation. Like, my wife and I had a conversation the other day. Joe, who we mentioned, he and I had a conversation yesterday just about me physically just taking care of myself. And I think one of the things, you have to have a culture
Mhm.
of honest dialogue. And I think
Yeah.
too many people, a lot of the folks that would sit and judge that for occurring, they've got holes in all of their processes, but they've just been lucky enough to have never had an issue.
Mhm.
So I think for me, I'm aware enough too of my own addictions and my own vices look different, and they're more culturally acceptable. My Snickers bar is a lot more acceptable than a bottle of Hackadan, maybe, but
Sure.
it's my vice. And
Right.
so I don't judge Kim for sinning differently than I have. It's just like my personal approach to it. But like she's mentioned, all of the conversations she and Ray have had, and all of the folks, it does take a lot of work and honest conversation and communication, because if you have somebody coming back into that situation, a lot of us look and say, well, what does Kim owe the pharmacy, and what do we owe Kim to make sure we support her and make sure she's in a position to be successful, because nobody's more aware of your faults than the person who's committed them, right? So we just have to make sure that we support her and don't put her in situations that would put her at risk.
Right. Well, no wonder your organization has such a great reputation with leaders and approaches like that. That's fantastic. As we wrap it up, do either one of you have any words of wisdom for pharmacies that would like to implement a return to work program but have never taken that step?
One thing that I would say right now that I'm hearing is just be open-minded to the person who comes perhaps in interviews for a job, and they come and tell you straight out, which I know can be a shocker, and says, I'm in recovery. I know a lot of people are like, holy cow. I would be more concerned about the person that doesn't tell me that versus the
Oh, of
person that
course.
tells me that.
True.
And so, but that should be a plus. And again, I know a lot of people that makes them very nervous. But I would also say when the person comes back, maybe be open to doing something part-time, let them just kind of gradually come back if that's possible. And have, if nothing else, ask TPRN, someone like me, to come with that person to their new, back to the workplace and help them set up, like, what does this look like for you coming back? What are we going to do different that we didn't do before? And we can help them with that.
Yeah. And the thing that I thought about too is, you know, maybe stick your toe in the water instead of doing a cannonball, right? So if you're considering this, but you have a lot of reservations, you know, we reference our state recovery network. Maybe you're in a state that has a similar network or opportunity with your board. If not, maybe there's a church or just a civic organization that does recovery work or things like that. Just get involved and just get associated with folks, because a lot of that comes from, and I mean using this term properly, a lot of it comes from an ignorance. We've never been around or experienced that before.
Yeah.
And then the other thing is to have conversations on the front end, like we talked about, is assess your pharmacy. Just try and make sure you have a culture of honest conversation, honest dialogue, where, you know, like I said, in my situation, I don't mind at all. I love Joe for coming and getting in my business and going, hey, you got to take better care of yourself. You know, so be willing to have conversations like that about anything, not just recovery related things, but have a forward thinking culture.
Right. Great points. All right. I want to thank you both for your time. I want to thank the listeners for tuning in to today's episode of Diversion Insights. And we will wrap it up there with those great words of wisdom.
Thank you for the opportunity to share.
Thank you so much.